We are Poseidon Pathology Laboratory, providing you with information you need when you need it. At Poseidon Pathology Laboratory, our mission is to strengthen patient care by providing quality clinical laboratory results as an institution dedicated to knowledge-based healing. Our vision is of a team of scientific innovators that seek to enhance the health and well-being of each patient and achieve community wellness by way of cutting-edge technologies. Poseidon Pathology Laboratory's scope of service provides diagnostic support to physicians throughout the city of Atlantis. Our services include hematology and coagulation studies, microbiology, and cytogenetic molecular analysis.
At Poseidon Pathology Laboratory, we have thousands of square feet dedicated to serving the city of Atlantis and the surrounding areas. Each patient specimen is received and stored in the appropriate environment by our specimen processing specialists. From there, patient specimens are transported to their destinations via our state-of-the-art automated delivery system or courier personnel. Once your specimen arrives to the designated department, our devoted team of medical laboratory scientists efficiently process and assess each sample to ensure quality results in under 5 business days. All patient results are reviewed by department directors specializing in each field as a final validation of the accuracy of each result prior to its release to our clients. Here at Poseidon Pathology Laboratory, we believe a patient-oriented approach to healthcare is the most effective method. Each member of the Poseidon team plays an important role in each patient's care and works together to facilitate wellness in our community. Our laboratory is home to a number of complex tests and subsequently complex interpretations. Thus, we are committed to hiring qualified technologists and department specialists to process and analyze your specimens.
Here you see personnel requirements of Poseidon Pathology Lab. At Poseidon, testing that is performed is typically of moderate complexity. Moderate complexity testing personnel can be any of the following: MD, DO, DPM with a current license in operating state, PhD in biological, chemical, and/or physical sciences, MS, BS, or AS in medical laboratory science, biological, chemical, and/or physical sciences, military-trained medical laboratory specialist with a high school diploma. Poseidon Pathology requires its testing personnel be nationally certified clinical laboratory scientists. In this way, we can ensure our testing personnel are formally trained laboratory professionals. Continuing education is a mandatory component of being a clinical laboratory professional. Poseidon Pathology Laboratory provides our employees with continuing education opportunities and encourages our laboratory professionals to present new and exciting information to their peers for PACE credit. Continuing education credits may be completed through the accreditation agency, such as the American Society for Clinical Pathology as well. Additionally, semi-annual competency assessments are completed for each laboratory professional in each department at Poseidon to ensure laboratory staff are competent on all department procedures. The Poseidon Pathology Laboratory is dedicated to quality and efficiency. For this reason, we strictly offer tests that we can perform rapidly in a fast-paced environment while maintaining confidence in the results we produce. Here you can see the tests broken down by department with specimen requirements, turnaround time, complexity, and ICD-10 codes. Note that the stated turnaround times are not applicable in cases of unforeseen circumstances or confirmation studies.
The Hematology and Coagulation Department at Poseidon proudly uses state-of-the-art technology for hematological diagnostics. Examination of the numerical and/or morphological findings of the peripheral blood are useful in the diagnosis of hematological disorders, including anemias, leukemias, allergic reactions, as well as viral, bacterial, and parasitic infections. Coagulation assessments, like prothrombin time, are useful in the diagnosis of genetic disorders, like hemophilia A and B, as well as von Willebrand's disease. A complete blood count with differential is used to assess the red and white blood cells, hemoglobin and hematocrit, and is often used as a screening test for leukemias, anemias, and infections. A PT-INR measures the coagulative capacity. This is how long it takes blood to clot. Prothrombin time can be used to detect bleeding disorders. A reticulocyte count determines the percentage of reticulocytes in the peripheral blood. This is used to evaluate conditions that affect red blood cells and bone marrow disorders. Poseidon's hematology laboratory utilizes an automated quantitative Sysmex analyzer with advanced and precise analytical features, pictured to the right. The Sysmex enumerates and measures the size of red blood cells and platelets by using the hydrodynamic focusing method. Hemoglobin is assessed based on the cyanide-free sodium lauryl sulfate hemoglobin detection method. White blood cell differentiation and enumeration are carried out using flow cytometry, with a semiconductor laser exploiting the differences in cell size, complexity, and nucleic acid content. Cells are treated with an acidic lysis buffer that lyses red blood cells and white blood cells, but not basophils. The remaining white blood cell nuclei and intact basophils are differentiated by cell size and internal cellular structure. The differential cell placement is then enhanced utilizing the Sysmex adaptive cluster analysis. A manual differential is performed given an indication of malignancy or abnormality by the Sysmex instrumentation. Pictured are some of the commonly used safety data sheets associated with our Sysmex system. These include the Stromatolyzer 4DL, the Cell Pack, and the Cell Clean. However, Sysmex controls and calibrators do not contain any hazardous materials and therefore do not have SDSs associated with them.
The microbiology department at Poseidon is able to identify and detect the presence of etiological agents using simple yet effective techniques. Here at Poseidon, we offer a variety of tests in the micro department, which include the Gram stain, which is an integral component of any microbiology laboratory. Upon microscopic examination, Gram stain is useful in the diagnosis of commonly acquired infections, including Staphylococcus aureus, Streptococcus pyogenes, and Escherichia coli. The rapid strep test is a diagnostic rapid antigen test which uses patient throat swab specimens for the identification of group A streptococci and the diagnosis of bacterial pharyngitis. The HIV ELISA test is used to rapidly screen patient samples for HIV antibodies. Upon detection, a Western blot is used to confirm the presence of HIV antigens and antibodies. As mentioned, one of the key elements in microbiology is the application of Gram staining and the interpretation of a stain using a bright field light microscope. Gram staining is known for its simplicity and rapid turnaround time. In the clinical microlab, having the knowledge of cell structures aids in the elimination of potential disease etiologies. For example, learning that an isolate is gram-positive does not give you an automatic diagnosis, but it will help you to rule out what it is not. This information can further aid in determination of the best choice antimicrobial drug until the isolate can be cultured and tested for drug resistance. None of this would be possible without a microscope, along with a Bunsen burner for heat fixation and a few select reagents for staining. Microscopes can have easy upkeep and typically do not require intensive maintenance. They can be large or small and compact, depending on the needs of the lab. In regards to upkeep and size, the same applies for a Bunsen burner. In our lab, gram staining is performed following the Standard Operating Procedure, or SOP, generated and approved by Poseidon staff. The components of the gram stain are a Bunsen burner, crystal violet, 70% ethanol solution, safranin, and grams iodine. Following staining, oil immersion light microscopy is used to examine each stained patient specimen. Additionally, quality control specimens should be used, such as Staphylococcus aureus as a gram-positive control and Escherichia coli as a gram-negative control to confirm result accuracy. Smears are prepared by fixing the specimen to a glass slide using a heat source such as the flame of a Bunsen burner. Once fixed, the slide can go through the staining process. The slide is flooded with crystal violet. Gram-positive organisms will retain this dye and appear purple due to the composition of gram-positive cell walls. The slide is then rinsed with distilled water and flooded with iodine, which will form insoluble crystal violet iodine complexes within the gram-positive cells. After another rinse, 70% ethanol is used to flood the slide to decolorize or wash out crystal violet from all cells except those that are gram-positive. Again, the slide is rinsed with distilled water and then flooded with safranin to counterstain. Gram-positive bacteria will remain purple, but gram-negative bacteria will now appear pink or red. The slide is rinsed one last time with distilled water, blotted gently with soft filter paper, and allowed to dry before examination under a microscope. This SOP refers to all related and relevant SOPs, such as one for the use of a light microscope. Additionally, all relevant material safety data sheets and pathogen safety data sheets will be included for the gram staining SOP. Safety data sheets associated with the gram staining procedure include immersion oil, crystal violet reagent, 70% ethanol solution, safranin, and grams iodine. Pathogen safety data sheets associated with the gram staining procedure include Staphylococcus aureus and Escherichia coli. These will be collected from the manufacturer of the materials or are also easily obtained online free of charge.
The cytogenetics department at Poseidon is oncology-centered, with our fluorescence in situ hybridization assays playing a significant role in the treatment of cancer patients throughout the community. Using fluorescence microscopy, diagnostic and therapeutically relevant chromosomal aberrations are visualized in malignant cells from a variety of specimen types. Our test menu includes HER2 FISH, ALK, ROS1, and Eurovision. HER2 assesses the amplification of the HER2 gene on chromosome 17 for therapeutic application of Herceptin in invasive ductal breast carcinoma. ALK and ROS1 assess gene rearrangements for the therapeutic application of Xalkori in non-small cell lung cancer. The Eurovision assay is an FDA-approved assessment of 4 disease-relevant chromosomes 3, 7, 17, and 9, for the monitoring and diagnosis of bladder carcinoma. Performance of each oncology-focused fluorescence in situ hybridization assay uses guidelines provided by the American Society of Clinical Oncology and the College of American Pathologists. With minimal instrumentation and an effortless setup using Dako HER2 IQ-FISH PharmDx reagent kit, HER2 and ALK-ROS1 FISH results can be processed within 1 business day. Commonly used safety data sheets associated with the HER2 FISH assay include fluorescent probes, ethanol, and Citrosolve.
At Poseidon Pathology Laboratory, we are focused on creating a culture of safety. Safe laboratory practices not only ensure employee health and safety, but patient safety as well. The safety officer in each laboratory department assesses the risk of all laboratory materials and practices with regard to 6 safety hazards: chemical, biological, physical, radioactive, electric, and fire. The safety team at Poseidon formulated an in-depth safety procedure ensuring that it is in compliance with the Code of Federal Regulations, including the blood-borne pathogens standard and the occupational exposure to hazardous chemicals in laboratories. Engineering controls are implemented to keep employees safe regardless of bad personal habits. Employees are required to review the safety plan each year and demonstrate full comprehension of proper safety practices. Poseidon supplies all employees with equipment and protective articles necessary to safely operate within the laboratory in compliance with the Occupational Safety and Health Administration General Duty Clause. Poseidon Pathology Laboratory Safety Plan includes all necessary information regarding occupational health and safety, including dress code and chemical hygiene. All safety procedures are reviewed by all laboratory personnel annually and updated as needed.
Proficiency testing is a semi-annual interlaboratory comparative assessment to validate the accuracy of moderate and high complexity tests. Poseidon Pathology Laboratory eagerly participates in proficiency testing programs for each analyte in our laboratory. The College of American Pathologists is one of the foremost CMS certified agencies in laboratory proficiency and compliance assessment. Participation in the CAP proficiency program is crucial to the reputation of most clinical laboratories. For analytes in which CAP does not offer proficiency assessment samples, the laboratory employs additional CMS certified proficiency programs.
At Poseidon Pathology Laboratory, we have employed the Orchard Harvest Laboratory Information System. Orchard Harvest is a foremost company in product development, training, service, and customer support. Compared to other laboratory information systems available in healthcare, Orchard Harvest is on-site customizable with a logical workflow. The most notable features of the Orchard Harvest Laboratory Information System are expert interfacing and integration capabilities, electronic medical record systems, robust rules-based decision support logic, and data mining technology for retrospective data analysis. Advantageous features of Orchard Harvest Laboratory Information System include audit trail, data analysis and auditing, data security, EMR interface, fax management, instrument interface, multi-location printing, physician test panels, and sample tracking. Additionally, Orchard Harvest LIS is most cost favorable and offers a wider variety of training and customer support when compared to other systems.
At Poseidon Pathology Laboratory, we strive to train our staff to identify non-conforming events and problem-prone processes within the laboratory. Identification of potential adversities will enable prioritization of process improvement events, such as just do it's and rapid improvement events, to correct processes that may have a negative impact on our quality of testing and patient care. The following actions should be taken. Risk assessments. Perform an overall safety and risk assessment of each laboratory department. Reporting an error or event. Once an error is identified, it should be reported immediately so appropriate actions can be taken. Review of an error or event. Brainstorming sessions should include staff from every level to enable an all-encompassing view. The corrective action plan. Assign a staff member responsible for carrying out each corrective action. Assign specific start, follow-up, and end dates for every corrective action. The validation process. Assess the process to ensure corrective action items are working as intended. Solidifying your process. Create or rewrite operating instructions. Route them through management for edits and approval. We thank you for considering Poseidon Pathology Laboratory as your choice of reference laboratories. We know you will not be disappointed. Please take a moment to review the references on this page that we utilized during this presentation.